So I'm briefly going to talk about blackouts. Blackouts are extremely common. About half of the population of the UK will experience one blackout at least once during their lifetime. And in the vast majority of cases, it's usually pretty harmless. So the first thing is definitions. What is a blackout? So we tend to categorize this using the medical term syncope. And this is when you briefly lose consciousness, but then come round again, and the episode lasts no more than a couple of minutes, and you usually make a full recovery. And there are usually three main causes. The first is something called reflex syncope, which is a technical term to describe a fainting episode. So this is when your blood pressure might transiently drop. It might be during a hot day, you may have not eaten properly, you might have been standing for a prolonged period of time. And as the name suggests, reflex syncope, it's a reflex, and it's a way of your body making you bring your blood pressure up by making you faint and lie down or sit down. It's usually pretty harmless, and it can usually be managed by simple lifestyle measures, which we'll talk about later. The second most common cause is something called postural hypotension. So that's basically when your blood pressure drops if you've been standing for a prolonged period of time. Often this is seen with people who might be taking blood pressure tablets. And then the third thing, which is something I worry about particularly, is if there's an underlying issue with the heart, which might cause you to be blacking out. And that's usually a little bit more serious and requires further evaluation and further attention. So how often do heart problems lead to blackouts? So of all the cases we evaluate, probably about 15% might be due to an underlying heart condition. And these heart conditions can include a slow heart rhythm, which might need a pacemaker, or an issue with one of the heart valves if they're narrowed, or some of the faster heart rhythms as well. How do we evaluate if the heart is causing the blackouts? Well, there are a number of simple tests we can do. The most common one we do is something called an ECG. This is where we take a brief tracing of the heart, we stick some stickers across the chest and take a 10-second printout and look at your heart rhythm and the pattern of activation of your heart on your ECG. The other test we do very commonly is something called an echocardiogram, and that's an ultrasound of the heart where we look for how well the heart is pumping, or look to see if there are any issues with the heart valves. The ECG I mentioned earlier takes a snapshot image of what your heart rhythm is doing over a very short period of time, 10 seconds. But if that doesn't coincide when you've had your blackout, or when you might be feeling dizzy, then it's not particularly useful test. So we may leave this on for a longer period of time. So it's usually a sticky patch or some stickers which we stick across the chest, and you take the monitor home with you for 24 hours or longer, up to 7 days often. And then you return it after you finish the recording, and we have a look at your heart rhythm and see if there might be any issues which might be causing your blackouts. So how are blackouts treated? Well, that really depends on what the cause of the blackout is. If it is the simple faint, the reflex syncope, which we call it, then it's usually lifestyle measures which can make a huge difference. The key thing is, if you feel a faint coming on, is to sit down or lie down at the earliest possible opportunity. Making sure you have a decent fluid intake is really important, and if people have recurrent episodes of these faints, we would say try to drink up to 3 litres a day. However, if there is another cause, then we need to treat the underlying cause. And certainly if it's an issue with the heart, then we need to treat the underlying heart disorder. So if it's due to a slow heart rhythm, then a person might need a pacemaker. Usually that tends to be more common in people over the age of 50 rather than under the age of 50. If there are issues with the structural function of the heart, we may need to do different things to address that as well. The key thing is that if you're worried that there might be an underlying problem which may be causing you to black out, is to seek medical attention. And if you'd like a further evaluation, then you can contact my team. The details below.